All right, welcome everyone to the Mind, Body, Spirit Virtual Summit. I'm so excited today for our guest, my dear friend and colleague, Dr. Cari Jacobson. So welcome, Dr. Cari. For those of you, the guys that don't know, probably most of you do, but Dr. Cari and I practice together at Be Optimal Holistic Health Center in Glenview. So I couldn't think of a more perfect person to have on the summit. So I'm going to introduce you guys to Dr. Cari first, and then we'll get to questions. So Dr. Cari has been practicing chiropractic and holistic medicine for 11 years and is licensed to practice in both California and Illinois. She opened Be Optimal Holistic Health Center in 2010 in Glenview, a northern suburb of Chicago, with a vision to educate, empower, and help people become their best self by achieving and maintaining optimal health and wellness. She is a healer's healer and is recognized in the holistic community as being a conscious thought leader on helping people reconnect to living their truth and experience a state of optimal well-being. She takes pride in catering each treatment to each individual, utilizing over 15 techniques to help attain balance structurally, chemically, emotionally, and energetically. She strongly believes that when we are in balance, we thrive. So welcome, Dr. Cari.
Thank you. Thanks for having me.
Of course. So first, I'd love for our listeners to get to know you a bit. Probably a lot of them don't know you. So I'd love to start with your background story. How did you get into health and wellness, and more specifically chiropractic?
I was thinking about just the whole progression of how I truly did get here. And actually, when I was around 12 years old is when I went to the chiropractor for the first time, because I played sports. I did softball, I did tennis, I did volleyball, but I was also a dancer. Like, musical theater was my passion, so that's what kept me really busy. But I was contorting my body in like 12 million different ways. Right. And I found that I was experiencing a lot of back pain. And thankfully, my mom was progressive enough to bring me to a chiropractor, because that was the saving grace for me. It allowed me to be as active as I wanted to be and to feel really good. And I think I went like a few times in a short period of time, and then I would just go like once a month or so, and it kept me moving, it kept me shaking. So that was sort of my first introduction to chiropractic, and it always sort of weaved its way back into my life. And then when I was 21, I was on the road, actually traveling across the States and then through Europe, performing and doing musical theater stuff. And I had planned a trip for the cast to go snow skiing, and ended up tearing my ACL, like complete tear.
I did not even know this.
Really?
How is that possible?
So I had to come back home. I was very down and depressed about it. And my mom was like, right down the street, there's this place called Omnis Chiropractic that I noticed, and maybe try it out. I was like, okay. Right. So I went, I met this woman by the name of Dr. Deidre Wagner. I'm a Cancer. She's a Cancer, in terms of like our birthday, but she was about 10 years ahead of me. And we just found this really incredible connection, and she practiced applied kinesiology, but like very basic applied kinesiology, which basically what she would show me is, here's this muscle that's, strong. When I touch this spot that, is sore on your neck, muscle goes weak. Right. And then let me adjust it. And now let's show you how when you touch it, the muscle's strong. I was like, whoa.
Totally.
So cool.
Yeah.
And I was kind of hooked in, at least as a patient.
Yeah.
And she wanted to learn yoga. I was like, I could teach you yoga. And so I started teaching her yoga. She started giving me chiropractic, and we just became really good friends. And almost in the same breath of saying, like, I could never become a chiropractor, like my brain doesn't think science.
Right.
I was like doing pre-med prerequisites to go to chiropractic school. I swear the decision was almost like made for me.
Yeah. Well, that's what a lot of people say. Like, you don't find chiropractic, it finds you.
Yeah.
Which I think is so true.
It's very true. Yeah. And at least for me, simultaneously, I met a guy through, like, my mom had met him at Comp USA. and his name is David, and he ended up being like her IT person at her business. Only he was also like a clairvoyant, and he worked with energy and all these things. Well, I didn't know anything from energy.
Yeah.
And he kind of took me under his wing, and he kind of freaked me out, actually, because I was like, what is this energy thing? And I don't know. But simultaneously, I was so curious that it like beat the like freak out of that weirdness was. And so I was, along with Dr. Deidre Wagner, I was like exploring this concept of energy.
Yeah.
And like, what is this thing? And actually, that was my first experience, like really feeling, even though I didn't really quite feel this idea, but it was the idea of energy.
Yeah.
I didn't quite feel what I knew that he felt.
Yeah.
Energetically, but it like blew open a door of
like
curiosity.
You knew there was like something to it, and like this is true.
There was something more, and like that was it. I was like bitten by the like energy bug, and ever since I've been running with it.
Right. That's awesome. Yeah. So, okay, you get hooked, you're learning energy stuff, you're doing prerequisites. When in school then, because of course I know like what traditional chiropractic training is, and it's like not even close to what you and I do. So how in your schooling process did you fall into applied kinesiology? Was it immediately because of Dr. Deidre? You like went right there? Or?
It was immediately. Like I'm from Chicago area. I grew up in the northern suburbs. The minute I could get out and go out west, I did. Yeah. So I went to school in Southern California, and I thought I was never coming back, by the way. Love it out there.
Yeah.
And there was this guy, Matt Lyon, who's this incredible being, as well. He's a great chiropractor who works on the East Coast now. And I remember him coming into my first semester of chiro school's class, all psyched about biotics, nutrition, and applied kinesiology, and using muscle testing to find nutrition.
Right.
And he was also like, there's this 100-hour start now. And I was like, maybe I'll wait. I mean, I knew nothing. I had zero science background. I was like, I need to like focus on science. He's like, no better time than now. Do it now. I was like, I guess I'm doing it now. You know, I was like, okay, like I'm going to do this thing. And not only was I going to do it, but I was going to be driving 8 hours to Northern California with some friends to with Dr. Tim Francis, my 100-hour course, which was one of like 5 or 7 since I've graduated.
Right.
Oh my God. But I did start, and I mean, they would make reference to like a bone in the foot that any chiropractor would know. I had, like, me and my friends, and they were like, what?
You hadn't even learned it yet.
We were clueless. But it didn't matter. Like the information started sort of like assimilating.
Yeah.
And, that I started right away, and little did I know how incredibly complex applied kinesiology was.
Yeah.
It was amazing.
I would bet some of that knowledge probably helped you once you were learning, even in the basic sciences, right? Because you're like, oh yeah, I've already learned that in applied kinesiology. I mean, I remember some of that happening to me, and it helped me remember stuff better because I had a different connection to it. It
gave me a purpose for learning in school, because school's intense.
Right.
And there's so much information. And so it would like help me, it would remind me to remember why I was learning the intensity of all that science.
Yeah.
To put it in a practical application is what excited me.
Yeah.
So it made me want to study harder. It made me want to understand. And then I would have greater understanding in the applied kinesiology course. And then from the applied kinesiology course, I would go back to school and have greater understanding there. So it did play into each other. It was great.
Totally.
Yeah.
Totally.
It made school easier.
Yeah. No, exactly. It's so important, I think, this applies to any field, any type of student, to have that passion of why you're learning. And I think it's really, really hard if you don't like have the light at the end of the tunnel. Like, you already knew, this is what I'm going to do. Yeah. This is my purpose. So even like sludging through school, it makes a huge difference.
And little did I know the rabbit hole it was going to take me into for all the other techniques.
Mm-hmm.
If you're looking with applied kinesiology, you're looking at the triad of health. So structural, biochemical, emotional. So it's like, if I'm going to be really great at the structural side of the triad, then I need to really understand a lot of the adjusting techniques, how to move somebody's bone, or how to create, greater flow in somebody's body. And what if I can't adjust it really hard because their bone will break, their bones are so weak, or whatever it is, like how can I make an impact and how can I get specific? So, learning things like the specificity of adjusting in a technique called Gonset, or sacral occipital technique and using blocking, or, activator, or just like what almost all the schools teach now is diversified, or just like a little sprinkling of it all. It was so important for me to like really gain an understanding there. And then same with like the biochemical side. It's like, how do things really function in the body? And then the emotional side, right? So, and that's just continued to expand with multiple techniques. But what I will say is that I've always really known this whole sort of energetic aspect. I think intuitively I've known it, but it was that 20 to 21 year young part of me that, met that guy, David, who I thought was so weird, but so amazing all at once. Who really sort of bridged me into like the knowing of all the energetics that ultimately connect everything.
Yes.
And that I think is what like has molded my practice and continue to allow me to cater each session to each individual. Because we're all different in every moment. And so to do the same thing with each person every time, just in my mind, in the way that I practice, it just doesn't make sense to me.
Yes. Well, and that's why I know this topic is like so dense and like, but
so
I know it's crazy, but I knew I had to have someone on the summit talk about this, and I could not think of a better person. I mean, you had to do it. I remember, so those of you guys that don't know, like I landed in Dr. Cari's office, I don't know, it was probably my 3rd or 4th trimester in chiropractic school. And like you were talking about like basic applied kinesiology, like that's where I was at that moment. Like I didn't know any of this stuff. And I remember the first time I shadowed you in your office, you were like, okay, so some of this is going to look really crazy, but just like go with it. But that's why I knew I had to interview you about this, because I do think you're right in that, like, that is probably the biggest piece that guides your work versus other practitioners that are more focused maybe in the structural area or the biochemical area or even the emotional area. I feel like you let that energetic piece like really guide everything you do more than other people I've seen. So that's why I wanted to talk to you about it, even though it's like a beast of a topic to take on, which I guess.
And I'm going to do my best to just simplify it too.
Totally.
But I will tell you, when David first did some work on me, some energy work.
What did he do, by the way? Was it more like Reiki background or?
It was, so we had been kind of exploring Sufism, which is not really for me.
What is that?
Like Sufi, being like, it's an Islamic following tradition.
Okay, got it.
Okay. And the one thing that we both took from it that felt really of integrity and that was a match for both of us was this heart healing experience. And it was really just, for fear of sounding a little esoteric, I'm going to go for it. Right. But basically it was like bringing the light through our, like the divine source, if you will, into the heart space. And I had no idea what he was doing, but he was way into it. He got it. I was
right.
I don't know what you're doing.
Right.
But what I did know is that I would cry. Yeah. Every time he did it. I didn't know why I was crying. Yeah. I just felt warmth. I felt love like I'd never known, but like knew it, but never had fully experienced or fully known.
Yes.
And it would bring me to tears every time. And all I know is that you don't have to cry every time, you experience an energy session.
Right.
But that was my first experience. It would get to the place where I could not do anything but to cry, to release whatever was being released.
Right.
Every time afterwards, I would feel lighter than I'd ever felt.
Yeah.
And there's like, I always say, like, the proof's in the pudding, even if you don't understand it.
Sure.
And that initial thing was like, I had no idea really what he was doing. I just knew that a change absolutely had happened and it was changing my life. And it was because of that work that I think I actually even tuned into becoming a chiropractor. Like, I don't think I was as in tune until we started working together.
Yeah, like you had more clarity and just in alignment with yourself. And
right. And then, you know, fast forward to Dr. Tim Francis, who's been a huge inspiration in my life. And he was the first guy that I took applied kinesiology with. And he was great because he would always give us pearls, you know, like pearls of wisdom, clinical pearls of like how it even made sense.
Right.
What he was saying and how it would apply in the clinical setting. But when I really got to know him later on, when I feel, you know, to become a master in applied kinesiology, I don't know. I think like even diplomates are working towards mastery. That idea of in martial arts, you get your black belt and, you know, that's when the learning begins kind of thing. So I feel like on some level, the learning's just beginning and I'm, you know, 11-ish years in and I'm just like learning every day. It's so exciting. So what he taught me is the idea of you can fix what you can find, but if you can't find it, you can't fix it.
Yep.
And that is what really brings in the quantum physics concept of that everything's energy. And, you know, I'll explain it from the place of, you know, our whole being creates a circuit. Everything's energy within our being, but also we can be totally impacted just by looking at two people have an exchange that's really loving, really amazing. And it can totally move us. It can make our day just by watching something. It can shift us physiologically or can shift the way that we function.
Yes.
It can create a lightness. It can create a flow. It can uplift our energy. The same way of observing a situation that's really disturbing, it can make us literally sick to our stomach.
Right.
And many people have experienced things like that where they can't even describe it, but all of a sudden they just started feeling funky. And it was right after the person walked into the room that was kind of funky or whatever.
Yep.
Everything's energy and everything sort of affects the other thing. And our being is so complex. So it's fascinating. You know, quantum physics or like quantum theory talks about how it allows for particles to be in two states at the same time. Like meaning like multiple things can be happening at the same time. So oftentimes people will come in with a symptom and go, you know, I know this is here. Like we know our body better than anyone.
Right.
We're with ourselves 24/7. And they've been to a general practitioner, their internist, and they basically said, well, you know, all your tests are normal, everything's fine, you're fine.
Right.
But they know they're not fine.
Right.
And so then they go to the Mayo Clinic and they're fine.
Right.
They know that they're not. Something's off, something's not right. So that's that idea of, you know, unless you open the door to open the door to open the other door, you don't even know that that third door exists until you open those other doors. And how do you know to even open them?
Right.
So that's that idea of like multiple things are happening at the same time, but we don't know it until we know it. And that's sort of the quantum physics aspect of it or quantum theory. Like Stephen Hawking's, that was some of his life's work.
Yep.
You know, it's fascinating.
Totally. Well, I love that. I don't know if this is from Dr. Francis or who on applied kinesiology, or if it's even from someone else, but along with like, you know, you can't fix what you can't find. It's like you're only as good in applied kinesiology or if you use muscle testing in your work as the questions you ask.
Yes.
The body, right?
Right.
And I love that. It's so true, right? If you're using muscle testing to guide, like, okay, like the first, you know, your first experience, like where to get adjusted, you know, with muscle testing, or if you're using it in a different way, to let the body guide you.
Well, yeah, the body's just so specific, but it's only as specific as the questions you ask. So it's that idea. I use this example of like, hey, Abby, could you go wash your hands? And you come back and I go, did you wash your hands? And you go, well, yeah. And I go, and then I can ask a further question. Did you use soap?
Right.
Oh, no. Oh, okay. Well, can you go wash your hands with soap?
Right.
Okay. Right. Did you, and then you come back and did you lather? Oh, no,
right.
So it's like, you could think you got the answer. You could, based on assumption, I could have assumed that you went to the bathroom, you washed your hands with soap and water, you lathered for 20 to 30 seconds, and then you rinsed. But unless I ask it specifically, the body won't generally tell it. Sure. And it's all about protection. The subconscious aspect of our brain. And this is, again, this is what it is. This is sort of fact, but there's also a quantum theory aspect about it in the subconscious. And I'll explain. So in the subconscious part of the brain, it's the reptilian brain, which is all about survival, and it's the limbic brain, which is your emotional memory. So some would say, so there's no logic in that part of the brain. So, and the body will do whatever it takes to survive whatever situation, even if it's not in the highest and best for that person. And even if it's not at all aligned with what that person consciously wants in their life. They really want to move forward and they really want to this and that, and they keep ending up in this broken record pattern of something else, but that they've survived once before, and so they'll keep surviving it until that pattern's sort of broken. But one would say that the past, present, and future all happens right now. And what that means is, an example would be like, if you walked into a kitchen and you smelled someone cooking something and it instantly brought you to when you were 5 years old and grandma used to make this thing, that it took you right to the kitchen, and you're there, as real as it is this moment, you're in that kitchen with grandma cooking from the sensation of the smell. Right. Simultaneously, you're not. You're 20 years ahead and you're standing right here and you're right. So all these things are happening right now, but the past, present, and some would say the future, it's all right now. Yes. And so to me, that explains how healing can happen, because if we couldn't sort of rewrite some programming and help to sort of get the system to break patterns and to regenerate, then how would healing ever really happen? The body's ability to regenerate is really extraordinary. But if something that affected us at birth or at 5 or at 12 is still affecting us today, it'll keep affecting us unless we could tap into back there. Well, our cells carry that emotional memory. And that's based on the book Candace Pert's Molecules of Emotion. It's based off of the science of Bruce Lipton from The Biology of Belief. And then, there's other books like The Divine Matrix, where they talk about like the birth of the stars and the DNA of life and everything in between. that it's all about the bridge between imagination and reality. And beliefs are taught and beliefs can be changed. And so when they're changed, miracles can happen. But miracles are just things you never thought were possible. But if you believe everything and anything's possible, then anything and everything can happen. That's a miracle. It's amazing.
Totally.
That's exciting.
Totally. I love that. And it's perfect. You answered my next question, which was like, what are a couple books for people that want to like tiptoe into this arena? And I would totally agree with you with the Bruce Lipton and Candace Pert. Like that book, Biology of Belief, is...
The Divine Matrix is amazing. That's by Greg Braden. And then Quantum Doctor by Amit Goswami. He really talks about...
That book is deep.
He really talks about the evolution of health, that it's not a race. It's a slow experience, but that he talks about the place for emergency medicine and how when we're in an emergency situation, there's a surgery or there's a medicine that can really save a life or can sort of reset a place so that someone can keep functioning and then continue on their spectrum of health. That health is a continuum. And it's constantly evolving. And, Aboriginal medicine and Chinese medicine and homeopathy, it's all based on energy and how it flows or doesn't flow. So how we can help our body be stronger, and based on like the environment we create for ourselves, the belief systems, how we relate to those beliefs in our environment, and, you know, really being in a different relationship with your well-being. So just yesterday, I was in a place getting a lunch, and this woman's wearing a wrist, what do you call it? Like a
brace.
Yeah, she was wearing a brace.
Yeah.
And she could barely handle creating, making salads and stuff.
Right.
And I'm going, you know, like, have you ever thought about seeing a chiropractor for that?
Right.
And she said, well, I'm waiting to get a prescription because I'm going to go to see a physical therapist because, you know, and it's this interesting stigma that I hear all the time. Of course, she didn't know who I was.
Right.
And she said, you know, because when you go to a chiropractor, you're stuck going for the rest of your life, and they just want to keep seeing you.
Right.
And, you know, and with physical therapy, you know, you get your function back to like 98%. And once you do, they release you and then you're fine. And I said, well, I think that's really interesting. You know, I was I'm a chiropractor. And but what was funny is the guy next to her was like, oh, I want to see a chiropractor. Actually, I have all these things I want to, you know, work on.
Of course, yeah.
And I said, well, great, because I'm a chiropractor. So that's how it actually came forward.
Right.
She goes, oops. I think she was like foot and mouth. Oh my God.
Right.
But I said, you know, that there is such a stigma, you know, but it's really just a mindset. It's a preventative experience, meaning, would you not brush your teeth because it's just this thing that you, once you start, you always have to do?
Oh my God. I love that you mentioned that because I say this all the time. I'm like, how is it that dentists have totally owned this and it's acceptable across the board to have a doctor for your teeth that you go every single year and you take care of your teeth every single day. And you don't only go to the dentist when you have a root canal and your teeth are falling out of your head. Right. But it's like we're like the used car salesman, you know, because we're like, you should have a doctor for your spine and your body and treat it that way too.
Right. I don't know. I mean, the musculoskeletal system in your nervous system that actually communicates everything in your body to keep
kind of important.
Optimally. So my whole thing was like, you don't have to go forever. And when you feel how good your body can feel, why would you not choose to make it and to integrate it as a part of your life?
Right.
To keep yourself functioning as optimally as possible in that state of health and vitality, not just no symptoms.
Yep.
Or symptoms and no symptoms, or symptoms and then no symptoms. Like to really experience a state of health and vitality, why would you not choose that?
Right.
And interestingly, a lot of people would not.
Right.
They would rather just not know or not really pay attention to themselves in that way. At least in the Midwest, I find. Like out west, it's a little bit different. That was my experience. There's just more consciousness around your own individual health and taking care of yourself so that you can really thrive in what you choose in your life's goals. And that chiropractic and holistic medicine helps people to do that. Like there's more of an understanding of that in my experience on the West Coast. It's a little bit more progressive in that is a preventative for the body, just like dentist is preventative for teeth, cavities, root canals, things that can really mess you up. In the long run, let's prevent them from even happening in the first place. And I think what's so difficult is you can't really measure what never happened.
Right. Sure.
You know, like in your body, you can't measure how not sick you would have gotten. Because you don't ever know that you would have ever gotten there. So it's like, how do you prove or disprove? All I know is that, you know, when I get to see families and kids, and the families and kids keep coming back to me going, you know, all the other kids are sick. They're all down with the flu. They're all down with the cold, this and that and the other. But, you know, they haven't missed a day of school, you know, or they got hit with it, but it was gone in 24 hours, you know, because they have the tools to be able to keep their body in that greater state of health and vitality. It's like we can kick it. We can kick it so much faster when we're more connected and flowing. So it is just a different way of moving with life. And that's, you know, essentially what he's talking about in The Quantum Doctor. And actually in all these other books, that it's about getting to a space and place where you can make a different choice for your life that can change the whole trajectory of how you move in your life.
Yep. Totally.
Yeah.
So I'd love to know, how has this whole energy, quantum physics, quantum theory affected you personally? And do you have a story of maybe a issue or some sort of resistance or conflict with yourself that other things weren't helping and you did something more in that energy quantum field and it helped?
Yeah, so I've had a lot of really cool experiences, I feel like. One that sticks out is, So the one that sticks out, I would say, is I really, truly, from when I was a kid, like I had said initially, I had low back pain and it became very chronic. Mm-hmm. And even though it was intermittent, I mean, it would get to a place where I felt like I was 90 years old trying to put on underwear. You know, it was like I could barely, you know, it was hard to even sit on the toilet and to stand up from the toilet, you know, like just, it would really get like to that place of discomfort. And as much as I did, you know, some acupuncture and some chiropractic and got adjusted, there was just this space and place of kind of going to the in-between. Mm-hmm. And who I found was able to do that for me and made a huge shift in my life was John Newton. Mm-hmm. And John Newton is all about going to the in-between thought. It's all energy. Mm-hmm. He never touched me.
Right.
It was literally getting to the place of like nothing, of no thing.
Can you speak to what he does, what his work is?
To the best of my ability, I think he works in the quantum physics realm.
Yeah.
The energy realm, if you will. But he does forgiveness work, peacemaking work, where he'll go direct to divine source, God, mother, father, whatever you want to call it. He has no attachment on it's far from religious in any way. It's like whatever it is for that particular person, which resonated with me because that's how I work, you know?
Yep.
That's how we work, really. Right. And so, you know, going into that place where it's like going into your mind, into the feeling tone, not the story, because the story is the belief system.
Yep.
But beliefs are taught, they're created. It's what we made something mean. Mm-hmm. But 20 people could have made the same exact thing mean 20 different things.
Yep.
So not to get caught in the story, but to actually go into the place of nothing, mm-hmm. of like the no thing, of what the feeling sensation is, of like really going into the feeling, going deeper into the feeling, going even deeper into the feeling. And while you're doing that, he's going into prayer, not just for you now, but that idea of the past, present, future, of like whatever will happen as a result and what has happened ancestrally that has like created imprints in the DNA that has, you know, he would even say, I'm not even a healer. I'm not a healer. I'm out of the way. I just allow the work to come through me. He doesn't, I don't make any change, you know, and it's the same as we say, we don't cure cancer. We don't cure Parkinson's, Crohn's, colitis, headaches. We look to just get to the root cause to balance the body. And when the body is balanced on the triad and energetically and otherwise, then we can thrive and the body can
heals itself.
Yeah, exactly. Yeah. And so all I know is I'm in a group healing session with him. The energy, now I can feel the energy. Where like at 2021, I was like, this guy, David, I don't know what he's talking about.
Yeah.
Crazy. And I'll just take his word for it. I don't feel anything, but okay. Where now I'm feeling it. I'm hot. I'm like, and all of a sudden he's working on me and I'm going, I'm truly done with experiencing back pain.
Yes.
The way that I do. Yep. Back discomfort, back weakness, whatever you want to call it.
Right.
And it showed up in many different ways. And he said, great, are you willing to go there? Yeah, I'm willing. Let's do this.
Right.
And
how long ago is this?
What's that?
How long ago is this?
4 or 5 years ago.
Yeah. Okay.
So I've been in practice for how long? Yeah. I've had so many people work on me. It still creeps back in. Not as much as it used to, but it'll still creep back in. Yep. And so all I know is that he starts doing this process and asking me questions. And I don't even know what I'm thinking at this point. I don't even know. There's literally this space of nothing.
Right.
And that's the only way I can explain it. It sounds so ridiculous.
Right.
What?
Yeah.
But I begin to like pulsate my whole body, and I start crying. And I'm dramatic when I release. I can't help it. I'm a dramatic person. It's not like I chose to be. It just happens.
Right.
And then I start laughing hysterically. It literally sounds orgasmic on some level.
Right.
And I'm in a room full of, half of them are my patients.
Right.
There's 40 people, 50 people in the room. And I don't care. Right. All I know is that I just no longer wish to experience discomfort.
Yep. And
it went way deeper than the physical. Mm-hmm. Because if it was physical, it would have already been fixed, if you will.
Totally.
And so, and what I know is that from that moment on, not only did I experience healing in that room, but at least really everyone in that room experienced the healing that I did on the level that was for them, but that idea that we're all connected.
Yep.
I would say at least 10 people came up to me and said, thank you for being as vulnerable as you were and for releasing the way that you did, because it allowed me to release and let go. And multiple people had similar experiences as me on some level in that room that no longer are experiencing the symptom that they came in wishing. And he didn't work directly on them. He only worked on me. Right. So how's that possible?
Right.
That idea of quantum theory where the particles are in multiple places. We're all connected.
Yep. Totally.
And so I have not experienced, knock on wood, but that experience, that symptom of back discomfort and weakness and pain, that hasn't occurred in my being since that experience. And I wasn't even touched physically.
Right.
So that was profound.
Right.
And, there was another time where I went to Dr. Tim and I just said, I went to my internist. I feel like I can't breathe. I'm waking up like where I literally can't catch my breath. I feel this intensity, but the chest x-ray shows normal, everything shows normal. And he begins to open the door to really utilize this menuing experience of really asking specific questions and coming up with homeopathic remedies that are treating, concepts or the energy of like a pneumonia, but pneumonia hasn't shown in the physical form yet. Well, you know what? Knowing what I know, I don't want to wait for pneumonia to show up.
Yeah.
I want to just get to the place where I know my body well enough to know it wasn't 100%.
Right.
And what I do know is it takes things to be 40 to 60% progress in order to even show up on blood work. Well, I don't want to wait till then. I want to pick it up while it's still only energy.
Yep.
And maybe showing up a little bit as a symptom.
Yep.
And so that was profound because all of a sudden after that, it's like I could breathe again.
Yep.
I didn't have those symptoms, and it never did manifest into anything more than the discomfort that I was feeling prior to seeing him. So I feel like as weird or as esoteric or out there as it seems, it is the reality that we live in.
Right.
Just because we can't see it doesn't mean it doesn't exist. Like the minute a feeling is a feeling, and sometimes when you try to put words to it, it's missed.
Right.
Nobody can really know or see a feeling. No one can see a feeling. You could based on a belief say that, oh, that person's feeling that, but you don't really know.
Right.
Love is almost indescribable, like true love. And the minute you try to describe it, you miss. But love, it's an energy that we know.
Yes.
And that we experience in our own way. But so like those are some ways that you can kind of just relate into that energetic concept of like, it's nothing tangible. Love isn't a thing.
Right.
It's an experience. It's a feeling. It's an energy.
Yep.
But there isn't a tangible on it. There's things that we can make tangible to represent love, but those things themselves are not love.
Yeah, totally.
Right.
I mean, even the great scientists like Einstein and Nikola Tesla have said like everything is energy, period. When you boil it down to that.
Right.
And I can't remember who said this, but people have quoted like the future of medicine is energy medicine. That's what it is. 50, 100 years from now, who knows how long it'll take the science and technology to catch up with the truth is that everything is energy.
Right.
So it's very cool. So do you have an example other than yourself of like a patient who's had a similar experience where other traditional methods, maybe even like chiropractic, hasn't worked, but when you tap into the energetics of what's going on, that's what's shifted things?
Yeah, I mean, one really cool one is I do work over the phone, so I don't have to see someone. It's the same as John Noon. It's like I don't need to see someone in person in order to work on them. Now, it's not chiropractic.
Right.
It's consulting or energy medicine or whatever you want to call it. And I worked with someone, when I worked with Dr. Darren Weissman, it really exposed us internationally. And so people would call our office from all over the world.
Yep.
And so I had the fortunate opportunity of, and I still do, of working with people all over the world.
Right.
And one woman called, I can't remember if she was in Germany or the Netherlands or something like that.
Right.
But she didn't speak English well. And she was pregnant.
Yep.
7 months pregnant. And they found cancer in her cervix, on the cervix.
Wow.
And they were like, they actually did a second test to be sure and a third test just to be sure because she was pregnant.
Right.
So were they going to operate? And all of a sudden she said, you know what? I do not want to operate. I'm pregnant. I want to have this baby.
Right.
I don't want to, she wanted to do everything as natural as possible. She called our office and she brought her friend in who spoke great English.
Right.
And we worked 2, maybe 3 times over the phone through an interpreter.
Right.
And what we did was...
So she was just receiving the energy of the lifeline, right, is what you're saying, because she couldn't even understand what was happening.
Using love as a universal healing frequency,
right,
understanding it through an interpretation,
right,
of what he understood.
Right.
Connecting to different emotions that came up that, we don't know what we don't know until we know it. That idea of like, you don't know that the third door existed unless you open the first and second door.
Right.
So same kind of idea of this sort of thing that's playing like a broken record and what's getting in the way of a healthy pregnancy and having, being healthy and all these things.
Right.
And I don't even remember. I don't remember what we did. I followed, however, her, just tapping into her energy.
Right.
I just followed where her body guided.
Right.
She had a huge emotional release several times on the phone,
right,
the different sessions.
Right.
Through the interpreter. I mean, really fascinating.
Yep.
And called me after the second or third visit. She went back to the doctor.
Yep.
And she said, before you do anything, I want you to test it again and
right,
just see, because we have to be sure for real.
Right.
Sure enough, they did the test. No cancer.
Wow.
And she, they said, we probably got the test wrong.
Right.
Is what
of course.
they said.
3 times.
Yeah. They did it 3 times.
Right.
To be sure, because she was pregnant.
Right.
And she knew in her heart, she knew in her mind what had happened, which was that huge transformation happened.
Right.
She gained a greater understanding of what she was sitting with emotionally and energetically, and why something may have manifested as chaos or as cancer in the body. I didn't fix the cancer.
Right.
We just got to some root cause things that were kind of creating imbalance or chaos in her body, emotionally and otherwise. And since then,
her body took care of it.
Absolutely.
Yeah.
So, and she's been healthy since. She had a healthy baby boy, and I mean, it was really incredible.
Right. That's
so, awesome. There's been something as extreme as that, and then people that have come to me with a colostomy bag, where even the Mayo Clinic said, the Mayo Clinic that told her to eat, things bland like canned vegetables and bread and things like that, which I was like, wow, that seems backwards, but okay, because that food is dead.
Right.
So, okay.
Right.
Let's get you vital food, first of all. And second of all, she had been to many, many docs who said, you'll have the colostomy bag the rest of your life. This is a woman in her late 30s with young kids and wants to be going out. And, it was intense. And her colostomy bag within 2 months was able to be reversed. Putting her on good nutrition and really understanding what her body was actually asking for and wanting.
Right.
So again, it's knowing the specificity of each person and their body so that you can make those changes. And it feels so empowering for me because it takes the guesswork out.
Yep.
I don't have to try this way and then try this way and then try that way.
Right.
I just have to ask the right questions in the right time. Sometimes I have to really think outside the box to know what questions to ask. Right. And that's complicated and fun. And weave the perfect tapestry for that particular person, energetically, physically, nutritionally or otherwise, so that we can, get them to that higher state of health. Sure. So that was really amazing. And, there's even been people with, that hobble in, they can barely walk, and they've tried a massage and some acupuncture and other chiropractic, which I'm not bashing. There is amazing work that comes from that. Changed my life. Yeah. And there's something about when those complex situations are speaking for more than something that's just physical. Right. How do you know unless you know? Right. The ability to ask it. And so they've hobbled in and they've walked right out, or they've been wheeled in and they're able to walk right out. Right. And so there's those experiences too. And so it feels so rewarding.
Mm-hmm. Totally. So knowing that our energy field is so important, and it absolutely can impact our health other than the classic physical type stuff. What are I always like to give the listeners a couple things they can do to help support. So what are a couple ways people can help clear out their energy field or get into better balance every single day?
I think meditation is huge. Mm-hmm. We don't breathe enough in our life anymore. So I would say meditation, my husband Daryl always says meditation is medication. Yep. So I think, remember, even if it's 2 minutes every day to start your day and maybe 2 minutes to end, it can make all the difference in the way that your day goes. To just stop, set an intention, and move from a greater state of consciousness and from choosing, as opposed to just going with the chaos of however your day takes you. Yep. I think a gratitude journal is huge, because we do get caught up in turmoil and all the crap that's going on. Or that's not happening. Yep. But to really focus energetically, really, on the things that are great in our life, even if it's as small as so grateful that I have a roof over my head and that I'm under a really warm, delicious blanket, or just something like that. Right. It can bring that positivity and that higher state of energy into your life and begin to shift the way that you go. Mm-hmm. And I would say for a lot of the people that I work with that are healers and practitioners as well, a lot of us really, even in the corporate world, mm-hmm. we are exposed to so much energy coming at us all the time, and the electromagnetic frequencies in our face with computers and phones and all these things all the time. It's how do we just remove ourselves from that, or clear all the that's
sludge?
The sludge, that we don't even know. We don't know that we don't know it. We just know that we feel exhausted and we can barely see straight by the end of the day, or we literally start spinning. The world starts to feel off balance, or we feel off balance in the world. What do we do to ground and to sort of clear that energy? And I recently learned a technique from a friend of mine, Dr. John Makoff, called the Ring of Fire. And I think he learned it from another doc friend of his who does more energy medicine as well. And it's that idea of imagining a ring of fire kind of come over our head, burn away anything that's not ours, that's not in our highest and best, that doesn't belong to us, or whatever, and setting that sort of intention, then bringing that ring of fire visually down the energetic aspect of our body, around our body, and really seeing it, taking your time with it, really seeing it kind of burn away that which isn't a match to your highest and best, to your highest vibration. And again, visualization is a powerful thing. Bringing it all the way down to our feet, stepping out from the ring of fire, letting the ring of fire clean underneath our feet, so to speak, stepping back into it, and then bringing it back up and repeating that 3 times. So doing it a total of 3 times. It completely shifts your energy. It totally resets the individuality of you. It's it removes you from all the other people and things that you've been exposed to, or that you've emotionally connected with, and took on some of their sadness or chaos or whatever it may be. We can't help it. That's like human nature. It's all energy. We almost can't help taking on each other's energy.
Right.
And it makes it that much more important for like our energetic hygiene to do something like that, to literally keep our center clean so that we can show up from a pure place without projecting on somebody else that they have what you think or whatever. So that non-biased place is really, really important. So keeping that space of energy being clean and really being grounded, that's huge. You know?
Yeah. And I love that technique because, I mean, trust me, I love the crystals and like all that fun stuff. But that to me is more external, right? Like I'm going to wear this to shield myself, or I'm going to do a salt bath every single day, which all of that stuff is important and valid too. But I love that that's a tool. Like all you need is yourself, and you can be in that place, like that empowered place that's all you need to do.
Yeah. We can get sick from carrying around all that stuff and not even know why we feel so sick, because we think we're doing all these great things for ourselves and we're exercising and we're eating right, and all we feel is depleted, you know? And so it's because it's more than just the physical. It's more than just what we eat. Now, that is really important. It's more than just exercise, which is really important, but it is truly, I don't want to say but, and it's really, truly important to understand the energetics that we humans, we're a part of a much bigger thing than what we think.
Yes.
And we get caught in our own little world and think that's all that is. And it ain't.
Yeah.
It's not.
And that's why I think it's so important for people to just understand and kind of learn about this, because I even know with myself, like for a long time, I like wanted to deny that I was energy sensitive. Like I'm like, I don't take on anyone's stuff. I'm fine. But like I've totally been showed time and time again, like I'm coughing and it's like not my cough.
Yeah.
Like, hello. So I think it's a great thing for people to just have an awareness of, is probably the most important thing. You don't need to be an expert in it or whatever, but know that it's a thing and that it matters. Yeah.
It's funny. I was just doing a retreat. I helped facilitate a retreat last weekend. And when I was doing my talk, I did some demonstrations. You know, we do muscle testing. So we do reflex testing. We do actual muscle testing. Right. And I could just see, because this was not a holistic world, so to speak. You know, it was people that were, it was yoga and meditation retreat. But I could see certain people that were such skeptics, and I wanted so desperately to bring them up to be like, you got to experience it. It's one thing to hear it. It's another really experience it. But one comment that was made in the sheets was the chiropractic talk, you know, that was all placebo effect or something like that. Right. And I thought, wow, that's so fascinating. That was the perception. Because simultaneously there was another woman who also was skeptical and thought it was a big bunch of bull. And yet I gave them some tools, and I saw her, and the next thing that we did was a gong meditation, and my girl could not sit still. I saw her using this technique. Right. You know, she started, while everybody is totally like basically passed out and like snoring, she is like uncomfortable in her own skin and unable to be comfortable. And I'm sitting in the back of the room, kind of just in a meditation, sitting up, coming down from my talk, and I'm just observing. And I'm observing that. So afterwards I said, can I offer you some support? And sure enough, within 2 or 3 minutes, tapped in, using muscle testing, she said, how the hell do you know that? How do you know me? I go, I don't. Your body's guiding it. You know. She goes, I was one of the skeptics that thought this was a bunch of bull. I'm a huge believer. Fast forward 3 days later, she was at our health class. You know, she's been bitten by the bug.
Totally. You know, but I think it's so interesting when, especially like other professionals in our field might be skeptical and say it's placebo. And if you guys haven't yet listened to the interview from Dr. Perry Nicholson, you have to, because we talked a lot about the energetics too. And he's big in the rock tape community and like physical rehab type stuff, but he also taps into a lot of this stuff, which I love. And he says he gets all that comment all the time of like, yeah, well, it's just placebo. And he's like, awesome. Who cares? I hope it's placebo because it works.
Right.
And it's like, you could argue even so much Western medicine is placebo, right? I mean, it's
Sure.
all energy. Who cares? That's the whole point. Even
Right.
if it's
Proof's in the
placebo,
pudding.
you're shifting the energy and the perception, and they feel better.
Yeah.
So great. And I just love that. And it's like, what can you even say? I love that response. So, so I can't get off this interview without talking about levels of consciousness with you.
Okay.
Because I think it's another really important thing for people to be introduced to and know about it. And it's such an interesting, the scale of level of consciousness. So if you could just speak to Hawkins' work and that whole thing.
Yeah. David Hawkins, Power versus Force. He talks log to the base 10, 0 to 1,000 level of consciousness. Or 700 to 1,000 is enlightenment. 600s are like pure peace. 500s pure love. 400, 400s like good.
Right.
Anything 200 or less is destructive. Anything in the 300s or above is constructive.
Right.
So there's different ways of breaking it down with levels of, and everything as energy or vibration, if you will. So
Right.
like it's all vibration, and what is the vibration of this or that, and how can it uplift a vibration or kind
Lower,
of,
yeah.
we've been with people that just kind of suck our energy. It like seems to lower our vibration. Right. And people like, oh, I love hanging out with them. It ups my vibration, or I just feel better. So it's kind of based in that. Now he talks about that once you're at a specific level of consciousness, it won't change within a certain amount of small window.
Right.
I disagree. I think everything's possible. I think you can go from being literally in a destructive state to a state of enlightenment in one session.
Yeah, totally.
And it doesn't mean you're enlightened. So it means you're at a vibrational frequency where, if given the opportunity and the choosing, that you could be in a practice that can feed and fuel a vibration of enlightenment, where you can move from like that higher state or a greater state of love or whatever it may be. So we use muscle testing to tap into that concept of like log to the base 10 for the highest and best. Is this item on the menu or this item on the menu going to fuel me to keep my vibration higher? Like I use it everywhere I go. I test everything, pretty much. In terms of whatever's in my highest and best, and allows me to take another piece of information in making decisions. Right. Is it the be all end all? Not necessarily, but it's certainly a big part of the equation of how to make a decision that can be in the highest and best. And I think it also depends on the state and who's asking. Sometimes when I'm asking for my own self, I'm in my own way. I can't even really see for myself what is the best. And again, that's just being human. Much easier for me to be able to tap in for you, or you for me, than us for our own self. Sure.
And I think that's an important thing to note, because I think a lot of people that use muscle testing or energy testing or pendulums, like all that kind of stuff. Yeah. I feel like it's always best to just have a more neutral person do it. Yes. I know I've seen patients like that who have been really into the energy stuff, which is amazing. But they'll be like, they're, taking all this nutrition and doing this crazy diet because their pendulum told them to do it, know, and, I don't love to do that for myself. Like, I have you or another practitioner, like, what protocol should I be on for this specific symptom or whatever's going on with me?
I want to mention that Masaru Emoto, who hypothesized that water has consciousness, and he basically proved that yes, water does have consciousness. That he looked at water under a dark field microscope, which looks at things, cells and other things, while it's still living. And excuse me. And so he would look at vibrations, word spoken in different languages, word written on a specific like beaker, like you put it on the glass and in different languages. That idea of like the Torah, the Bible, like there's powerful high vibrational words. So when people read things like that, they feel really good because the high vibration of what it is, whether they resonate or not, there's just power in word, and the word love versus hate. There's different vibrations and even music, etc. And so,
and didn't he also do it? I believe he did it with like even just looking and holding like happy thoughts and then like facing away from it.
Yes.
And like even that shifted it. So crazy.
Putting them in separate rooms, you know, things like that. And, you know, it made water that had rice in it, the rice that had love, I love you on the beaker, or was playing Mozart or whatever. It kept it after 4 weeks, there was no mold, there was no, and the one that said like, I hate you or whatever, it was literally turned black within a week. You know, so things like that. But the reason I bring it up is that you and I have even experienced writing things on a piece of paper and holding it blindly into our field to muscle test and calibrate different situational experiences and what might guide us to a decision that would be in the highest and best. So we take ourselves out of it. And it's really guided us in a powerful way where we go, wow, that's kind of what we felt, but this is such affirmation because we didn't know what was on these little pieces of paper. But again, I use that Emoto's work to sort of exemplify how vibration is vibration and our being is vibration. So it will pick it up. And
what is the title of his book exactly? Emoto's? Do you recall?
I'm not
something of water.
You know,
I'll find it and reference it.
He wrote a handful of books. But, there's not just one, but I'm not 100%. I could probably look it up really quick, but
we'll find it. I'll put it in the notes for the interview because that's his one about like water specifically is really good.
Yeah, it is. It's really good.
Okay, awesome. So people look up David Hawkins if you want to really, really delve in. That's also another like really dense book, but very cool. So a couple more questions for you. I want to know, what advice would you give to your younger self? Knowing what you know now with the wisdom you have, what would you tell that younger version of yourself?
You know what I often wish, Abby? That I could treat my younger self.
Yeah, totally. If you would have had like the access to what you know now.
Oh my God. I say it to these kids. I'm treating, you know, newborns and 3-year-olds and 6-year-olds. And I'm going, shit, I'd be in an amazing, amazing place in my life. Boy, would I have fast tracked so much better from all these insecurities and, you know, BS that we kind of like muddle through, you know, so much faster with so much more ease and grace, like had I had this work. So I don't know if I would say anything, but rather I would want to treat
you would say like, go find an applied kinesiology doctor.
2-year-old
Cari J and get in there.
Like, go figure out why the symptoms that you're experiencing of like discomfort where I didn't, you know, I would just sort of closeted kind of like hide my feelings because I wanted to just please everyone and be so happy all the time. Like, but there was a part of me that wasn't always that happy. Like, I would have loved to delve into the understanding of where that was coming from so I could just be at peace, like way more at peace, way faster in my life. You know?
Totally.
That would be awesome. That's what I would tell my younger self.
Totally. That's the best. I was like, you and Dr. Charlie had the same answer for that one.
Really?
Yeah. He's like, I tell myself to go get treated. Of course. Yeah. It's either that people say that, or the most common thing is just to like relax. You know, like when you're in your 20s and crazy and trying to figure everything out, like chill out, it'll all work out.
I was never really worried about that. I was just like, I'm going to do this. I'll do it. I was an event planner. I did it. You know, I like did all these things. I had like 12 careers before I became a chiropractor, you know?
Totally. So I want to know what's next for Dr. Cari Jacobson. What like new exciting things are coming up for you?
I'm hopeful to be doing quarterly retreats. We are actually just about to put for Be Optimal an online store so that it's more convenient for people to be able to get supplements and stay healthy with just general nutrition.
Yeah. And I love that because the world needs access to a high quality, high vibration, some would say, nutrition.
Correct, because there is a lot of crap out there. And that's exactly why we carry what we carry and as much as we carry, because we know then that people are going to receive high quality if they're getting it from Be Optimal. Like, we're never going to sell something that the minute we find out that something changes its manufacturing to at a lesser standard, we stop carrying it. Right. So people can rest assured that we're doing our research, we're doing the groundwork to make sure that things are, when it gets to our mouth and our body, it's clean and it, like you said, high vibration. Right. So I am really excited about that. I am linking in a personal page into the website as well, so that all the different retreats, my calling more than ever is to really ignite people into their truth, into living empowered. I love treating leaders and healers because the domino effect of that is profound. It's amazing. It's like if they can be in a higher state and they impact so many other people in their organization or whatever, or as patients or whatever that is, it's like the impact that I'm able to make them by helping impact them.
It's limitless.
It's incredible. It's that infinite, and I love it. So I think there's something about, like you said, learning to live it and to like keep your energetic hygiene there, to keep your physical hygiene, all of that. So to reconnect with Earth. Like, we're in this physical world in and of it in a pretty intense way. You know, we get caught in our everyday motion of computers and phones and, you know, going out and yes, and running. But all too often we just don't take enough time to retreat. So even a couple-day retreat, like what we did last weekend, was profound. Even for me as a facilitator, it stopped me to meditate 6 times for 30 to 45 minutes.
When else do you do that?
2 days. And to do yoga extensively twice during the time and gong meditation, you know. So I wish to do more of that, doing things like that, as well as connecting to the environment, doing things that really challenge our physical body and that mind over body experience.
Well, and people so need that. And especially in the Midwest, you know, if you live in California, probably in any town you live in, you could find a weekend retreat to go do. But here, not so much. So it's so needed.
It is. And I will be doing more of that. And keep posted on my website. So you'll be able to link into all the different things that I'm doing. I started blogging. I sort of went really hard and then it sort of fell to the side. So, but I have all these ideas. So it's just writing more and sharing more ideas, because some people read and it ignites them. Some people experience and it ignites them. Some people hear a talk and it ignites them. So for me, it's about tapping into all the different areas that can get people thinking about how they can shift their life, even just little tiny shifts, nothing massive. Doesn't have to be dramatic, you know, to really begin to make shifts in your life and to feel a little better, a little bit happier, a little bit more ease and grace in your life. And if I can be a part of assisting that to happen in people, more and more people's lives, not just one-on-one, but really worldwide, then I feel I'm living my life's purpose.
Totally. And it's like you said, even if it's as small as breathing for 2 minutes in the morning and 2 minutes before bed, that could significantly change your life. Awesome. Okay. So for you guys, I will leave the notes, like the books we referenced, all that great stuff in the notes below. And we will leave the website for Be Optimal, where you guys can keep in touch with Dr. Cari, see what she's up to, and the center we both practice at, as well as we'll link the online store. So you guys will have access to some great quality nutrition. Totally.
At a discount if you're watching.
Yes. Right? And we will list like a great promo code for you guys to receive a discount on whatever you choose to order.
One more thing.
Yeah.
You do dinner with the doctors.
Yeah,
If
talk about
people
it.
are local or not, because we're doing it live
It's
now
very
on
exciting.
Facebook and Instagram, you can log in, tap in. If you're physically can be there, we offer dinner for free. We offer great discounts just because people are showing up. Our passion at Be Optimal is about educating first and then treating so that people can really feel aligned with the work that we're doing, make sure that it's worth their time, that it's a match for them. And if it is, then we can't wait to get on board and, work as hard as they want to work to get them well. And so we start that with dinner with the doctors. So once a month, it's free, and people can really learn about what it is that we do, see demonstrations, and take away a couple of different tools that they can integrate into their life right then and there, and really start their journey, their path to health and wellness.
And they get to hang out with us, and that's pretty exciting.
Who doesn't want that?
Right, totally.
Yeah.
And so I'll link to that, you guys, because it's actually been really fun this past year. We've been doing really specific topics, which people have asked for. So like in May, we're talking about how to treat seasonal allergies naturally. In June, we're talking about headaches. In July, we're doing like the importance of sweating and moving and detoxing. So it's fun, different topics, so people can tune in based on their interests as well.
Absolutely.
Yeah.
Yeah.
Awesome. Yeah. I love that plug. Dinner with the
Yeah,
doctors.
baby.
It's the best. So yeah, guys, we'll have all this information below. Again, lots of fun nuggets of information from this interview. So thank you so much, Dr. Cari, for your time.
Thank you.
It was the
I
best.
really appreciate it.
Like, we don't have enough time together. We have to do an interview.
Always have more.
Yeah, it's the best. So yeah, check out the notes below, you guys, to follow Dr. Cari, all the exciting things she's up to. And I hope you guys enjoyed this interview.
Thank you.
Thank you.